Good evening. I'm going to call the August 12th Select Board meeting to order. I don't believe that there are any changes to the agenda. Before we begin, I will confirm member access. I'm Dawn Holgate, Chair of the Select Board. I will call on the Select Board members in the order in which I see you. Jason Bridges.
Here.
Matt Fee.
Here.
Christy Ferrantella.
Here.
Melissa Murphy.
Here.
Thank you. And then I will go through the town staff members that are present. Rachel Day.
Here.
Amy Baxter.
Here.
Libby Gibson.
Present.
Erica Mooney.
Present.
Holly Backus.
Present.
Roberto Santamaria.
Here.
Andrew Gorse.
Here.
Thank you. Then we have a number of other people joining us this evening for various items on the agenda. I just want to confirm that you can all hear me. Fran Cartoonan. Shane Corey.
Present.
Linda Mooney.
Yes.
Harry Shaw.
Present.
Hillary Rayport Hedges. Or,
Yes.
Is that backwards?
Yes, here.
Brooke Moore.
I'm here.
Simon Young.
I'm here.
Bob Davis.
I'm here.
Richard Hussey.
Here.
Rob Ranney. Rob, can you hear me?
Yes, I'm here.
Thank you. Okay, that's everyone who's on for now. We may have some people in and out. We are conducting this meeting remotely consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless participation is required by law. This meeting will feature public comment through the Zoom webinar where people can log in and speak as attendees, or they can type in questions under the Q&A. You can also call, there's a call-in feature as well. All of these details are found on the town website with all of our agenda materials if you would like to follow along. As we go to the items on the agenda, I will try and introduce each speaker and call on people as they raise their hands. Please remember to keep your computer or phone muted when you are not speaking. And please remember to speak clearly when you are to ensure accurate minutes, and wait for the chair to yield the floor to you and ask questions through the chair. Finally, each vote will be taken by roll call. With that said, for the 500th time, let's move to announcements. Libby?
We only have our census announcement, which I printed out. Let me grab it. Our census coordinator reports that just over 27% of Nantucket households have completed the 2020 census as of today. While that rate looks like a pretty low response, we believe from the little data that's available to us that full-time residents have responded at a much higher rate. Still, we're aiming for a complete count, and we're looking for all remaining households to take the census. If you are one of those households, what are you waiting for? It's quick, safe, and easy, and vitally important. Please do it now. 2020census.gov. Or you will need to respond in person with a census taker. They began door-to-door follow-up this week. And there is a Stop and Shop, $100 Stop and Shop gift card possibility. If you take the census, you can be entered into it. This is the last week to do it, so you'll miss out on that if you don't get it done as soon as possible. Details are on the town's Facebook page, and the drawing is Friday at 4.
Jason?
Don?
Jason, then Matt. Sorry, you both raised your hands.
I did the census maybe 3 months ago online. It took me 10 minutes. I got a confirmation. It seemed fine. But when they came knocking on my door this past week, they didn't have it on their end for whatever reason. So we had to go through it again at the door, which was fine. So I just wanted to say, if you did it online and someone comes to your door and you see it's a census, just check with them to make sure that they have everything that they need. Thanks.
Matt?
My comment, there was a couple of people have contacted me and thought they had done the census, but they were doing the Nantucket Street, Nantucket's count, not the national, not this one. So unless they've filled it out at 2020census.gov, they have not done it. And I've reminded a couple of people, but they were very, very confused. So that's part of our issue too, I think.
Thank you, Matt. That is a very good point. The Nantucket census and the national census are totally different. We'll try to maybe clear that up online.
Okay, thank you. We'll move next to our COVID-19 weekly update. Are there any opening select board comments or questions, or public comments or questions? Jason?
We've talked about this internally, and I've tried to kind of squash this rumor as many times as that I could. I myself and other select board members and town officials have getting calls from restaurants hearing that they're going to be shut down at 8 o'clock or maybe earlier. And every time I've heard, I said that's not on the table. No one's. I don't know where it started, but I just wanted to say on open session that I've not heard of anything like that, and that's not part of any of the discussions that we've had.
Thank you. I think a lot of us got that question. It's good to state that. If there's nothing else, I'll move to the, we have the report from the public health director, but we also have Gary Shaw joining us this evening. So should I go to Gary for some comments first? We haven't seen him in a couple weeks.
Sure. Thank you. It's a pleasure to be back in front of all of you. I know it's been a long road this summer and lots of activities going on that we can have that are safe. And thank you for the opportunity to come back and just give an update. We're moving along in the summer pretty well. We're seeing numbers, as you all know, that we report out, kind of a slow uptick in caseload. And that is intentional, and hopefully we see the onesie twosies click up, because what we've built is a very aggressive COVID detection surveillance program through what you funded in the town, and also what we have going on through symptomatic tracing or testing over at the hospital. So the numbers are growing larger. We're glad that that's occurring. Excuse me, a little frog in my throat. We're still able to access the Broad MIT Institute for their testing results. We use that exclusively because we're finding the turnaround time has been great. And we look out our windows here at the hospital and we see cars lined up early in the morning. More so now since the governor has put in place the testing criteria for coming in and getting tested 72 hours after coming from what's considered a hotspot state. So the numbers are going up slightly. We've planned for that. We expect that. And what we are seeing is that we still don't have community spread, which would be an indicator that our own community was not following the behaviors that we've all been talking about for so long. I would just tell you and the community to expect those numbers to continue to grow a little bit. From my understanding of talking to my staff, we'll probably see some individuals come to the end of the summer and volumes start to subside a little bit. But those numbers will still probably continue ticking away as long as we have so many people visiting the island. So I think that the work that you've done collectively as a community, the work that you've done as a Board of Health and also as the town leaders has been fantastic, and it's led to the stellar results that we have. So keep up the good work and keep passing the same message. I will say that as we move into the school season and the opportunity to bring children back, that we've been with Roberto Santamaria and Dr. Pearl meeting with the superintendent of schools, board of schools last night, had a long meeting with the teachers to talk to them about COVID and where we sit and opening and how things could work related to surveillance, appropriate distancing, hand washing, and so forth. So a very good dialogue, very collaborative, very proud to see that folks in the community are asking those questions. Obviously, there's a concern. But as I reported to this board many months ago, we've had a long time in this community to prepare and get our testing materials in place and be able to have resources to do contact tracing, to address clusters and other areas where we might see a breakout. So we have great resources, and I would be optimistic and probably proud to say that I think we've got some of the best resources in the state related to access, turnaround time for testing, and the ability to get on top of stuff. So we have the right resources. We're prepared, and although we don't want to see community spread, we do. We're prepared to go out and address it. As we move into the fall and we look at the normal flu season coming, it does create some concern in that, cold and flu season is going to pick up. COVID typically is a family name for colds. COVID-19 is a particular strain that is obviously what we're not too happy to have. But influenza is something we don't want to have either. So at the Cottage Hospital, we're asking you to ask your family members, the school, to immunize so that we can hopefully reduce as much collateral concern with through vaccines that do exist to prevent additional disease and infection that could come to the community and cause confusion related to COVID versus flu, measles, mumps, or rubella. So this is a time to be leaning into immunizations that we have. It's interesting that we want a vaccine for COVID, but we don't use the vaccines that we have for other illnesses that were equally as severe in past years that we worked so hard to get in place. So please go out and immunize. And we are working at the Cottage Hospital to make those vaccines available for the entire island, and work with the school system and others to go out and do on-site vaccine programs. So you can count on us to be stepping into that and meeting that as well. That's probably the update that I have. We still don't have people admitted to the hospital, for COVID. I'm just very, very proud of the community and the results that we're getting, and I think you should be too. That would be my report, Dawn.
Thank you so much, Gary. I'll go to Roberto next.
All right, thank you, Gary. We'll move on to the select board presentation. So, oh, wow, I just realized that was blank. So what we're finding is that, just to echo what Gary has done, what Gary was mentioning, we are doing exceptionally well. So as of yesterday morning, we've had over 4,800 tests. By the end of this week, we're gonna break that 5,000 mark, which is pretty tremendous when we think about the size of our community. And the CASNet program, which is the asymptomatic testing, has been very successful. How successful? So what we're seeing is that over the past week, we've seen a little rise in the incidence here. Nothing to really worry about. It's because we captured most of them through the asymptomatic testing, and that is required by the travel order. So as you test more, the more you're going to find. So as far as our metrics go, we're seeing green across the board still, which means that we're doing extremely well. I'm going to go through again. we still, as always, going through the same 7 criteria when you count the sewer. We're still at less than 1% positivity rate. That was when we did 46. There's now 47 as of yesterday at the end of the day. I didn't update this morning, but even still, great numbers going. And in our 7-day average, we're still only at around a 1%, not even a full 1%. So that is phenomenal. So moving forward, we have our quick age breakdown. We're going to see, you're seeing that approximately 40% of all of our cases are within the 20 to 29 range. Approximately 50% of them are below the age of 40. So that's the targeted age range that we've been paying attention to for education. And what we're finding is that it's pretty effective. So the state announced that they're going to be doing a weekly case load. So I uploaded this yesterday, so I couldn't get today's picture on here. But what you're seeing is the green, the same similar stop sign numbers, colors that you're seeing, where white is less than 5 cases reported. Now that we have more than 5 cases reported in the last 2 weeks, we're going to be showing up as green in the next map that gets released. But it's also nothing to panic because it is green. We're in still great shape. So where do we stand? So what's happening here, when you look at the state numbers, this particular picture here, when you look at the state numbers, you'll see the numbers on the left that are counted. You'll notice that are counted. You'll notice that Nantucket still says 37 on it. That's because we are still counting. The reason for that discrepancy is because we're counting every positive we get. The state doesn't always count that. So if we get a positive for it happened to be a person who was here just for 2 days, or a person who just started showing symptoms while they were here for a day trip and they went in, got swabbed, and it shows up positive for us, we definitely count that because they were here. They were here showing symptoms. Whereas with the state, if the person comes in from, let's say, Wellesley and comes in, shows up positive, their zip code says their address says Wellesley, they're counting it as a Middlesex County case. We're on our numbers still counting it as Nantucket because they were here spreading it if they were spreading it. So we still need to do our contact tracing. We're still following up on all those cases, regardless of whether they live on the island or not. Because of our transient community, we still need to follow up with all of those cases. We are, in many ways, going above and beyond what the state is doing. The partnership between the hospital and us has been incredibly robust. And even with that increased amount of numbers, even though we're, to the state's term, we're inflating our numbers, even though we're getting it positive, even still, if you look at this chart, we are still the lowest caseload in the state. That is, proof is in the pudding there. What we're doing is working, and we just got to keep it that way. So now is not the time to give up, to let up. We just need to maintain vigilance. I'll be giving this update every week, trying to keep this nice and short. No classroom setting this time, where every few weeks I'll be giving a quick update on other epidemiologic principles. If there is any questions, I'll go over this average daily case rate per 100,000, but that's only if you have any questions on that. That is called standardized incidence ratio. And that's a whole different piece of conversation there. And with that, I'll call it a day. Any questions?
Thank you very much. Does anyone have questions for either Roberto or for Gary? I guess we're just kind of maintaining. Good work, everybody.
Thank you.
Let's move on to our licensing administrator, Amy Baxter, for an update.
Thank you very much. Update this week is I just wanted to briefly go over what happened, the new governor's order that came out Friday afternoon. Thank you for dropping out on a Friday afternoon, but we have worked through to clarify it, and I'll just kind of go over a couple of the points because there were a lot of misunderstandings. Essentially, the governor was looking to stop a lot of bars that were trying to masquerade as restaurants throughout the state and limit gatherings. I think there was a misunderstanding that this affected the to-go policy right now that does allow these restaurants to sell alcohol with food orders to go. That is still in force. That is a separate legislative action that is still valid. So I wanted to clear that up. This was specifically meant to address on-premise consumption of alcohol. And essentially, what the governor's order does is require that anyone going to a restaurant and seated at a restaurant is for food service with alcohol. The initial order of alcohol has to come with food service. It can be, they thankfully provided us a description of what food is not, which is not chips or prepackaged food of any kind. It has to be food prepared on premise with their food service permit. And it can be shared food, things of that sort, so long as it's sufficient food to serve the amount of people at the table. So that was the basic part of the restaurant order, was that there is no going to a restaurant and just sitting down for a round of drinks. Bars are not happening right now, seated, standing, nothing. It is food service. Certainly, after they have their food, they want to order more drinks. That's allowed. It's just saying the main purpose for the seating is food. In addition, it limited gatherings. That does not affect occupancy in restaurants, as occupancies were not set per their reopening. It is based on distancing. So it is for special events, any events they might have in addition to seatings, and special events in other venues, and even in private property. The 100 maximum for outdoor was limited to 50. It's still 25 maximum for indoor, or is it eight per 1,000 square feet, or a maximum of 25 people indoor. So that remains the same as well. And then just one more thing that got not updated or more clarified was bar area seating. As far as folks have been repurposing the bar areas, as we've known, we've gotten that question a lot. And we have some clarification that there still needs to be distancing. However, the service to those tables in the bar needs to be coming from the service side. It cannot be coming from the bartender. So I know we've had some situations where tables might be pushed up to a bar and the bartender is serving to the table. That can happen. So I will share this clarification with folks as well. So I think that's just the basic part of it. Any questions on those?
Jason?
Thank you, Madam Chair. Amy, I ran into Amy today. We were talking about this, and I asked, what's the difference between a server serving a table than a bartender serving a table? And your explanation was good. I didn't think about it the reversed way. Could you talk about that?
I was trying to remember what I said. Roberta was there too, so he probably said the right thing. But I think it's it's a health and safety standard. Bartender, and a lot of times the prepared foods come through the bar area. You have someone right there that's unmasked as well, and you're serving to them, and then handling other food and prepared items that are going to other tables. So it is certainly a health perspective too. You can't just push a table up to the bar and have the bartender still serve you. That's not defeating the purpose of what they're saying. So they're just asking for the spacing needs to be the same, the 6 foot, and that they are served by a server who would serve other tables in the restaurant. If that makes sense.
Thank you.
Yep. Any questions?
Anybody else? Okay. I don't think there's any additional update on the emergency orders. We've just kind of been keeping the agenda the same. Are there any new PIO updates, Libby?
Not really. We are still noticing a lot of traffic on the town website, particularly on the COVID pages. But we're just really trying to keep up with all the state information and get it on our site with links and things as quickly as possible.
Thank you. Christy?
Sorry, I just had a comment about the emergency orders. I received a lot of questions this past weekend about why we voted on Friday to limit the service at midnight. And I just want to make sure that we have a clear kind of reasoning behind when we do these emergency orders and that it's a clear message. We hear kind of every Wednesday that we're doing really well. We just heard it again from Roberto that, Nantucket's doing exceptionally well, especially compared to the rest of the state. And then we take measures that are more extreme than the state. So if it's for public safety, if it's for precaution, just whatever the answer is, I think it'd be really important that when we put these orders through, we also have the messaging behind them so that we have the answers for the community members. Thank you.
Roberto?
Just a quick comment on that. Absolutely. Yes, we're doing very well. And of the cases, the reason we we recommended closing it earlier is because we saw cases caused by those lines. That's the thing. I'm trying to give out as little information as possible in order to stay in compliance with the regulations that are set by federal and state mandates. So I can't outright just walk out and say, we got 4 cases from the line at whatever restaurant or at the bar at whatever restaurant. I just can't say that because people can identify who it was. If we say the person was in the line at, I'll say a restaurant off island, at McDonald's, person was in the line at McDonald's on Tuesday, they can actually kind of find out who it was. It's pretty especially on a town this small. And actually, I have I was asked earlier today about the de-identified information and that sort of information. And HIPAA explicit, this is from the Health and Human Services website right here, that when a geographic unit formed by combining the zip codes contains less than 20,000 people, you cannot give that information. And in our zip code, we have less than 20,000 people. So I can't just tell you that we caught cases there. But yes, we caught cases in the lines of some of the cases. So some of the individual one-to-one person spread was because of the people who were in line together. That's why we recommended closing, and it was after midnight. That's why we recommended closing those timings. If we get more cases like that, once we cross that 5-person threshold, yes, I can give that information. I can say how many cases, but right now it's just below that 5-person threshold that the 20,000 of our 20,000 population hits.
Christy, go ahead. Oh, and then Jason.
Yeah, I just wanted to thank you for that follow-up. It was just when it comes down to if it's public safety or COVID safety, it's just helpful to have that answer. So thank you, Roberto.
Absolutely. And like I said, as soon as we hit the 6 cases or more that are attributable to this sort of behavior, I'd be happy to give that information.
Jason, question? Comment?
Yeah. That's back for Amy. I forgot to ask this when it switched over to the PIO stuff. Amy, on Friday, the Board of Health and Select Board talked a lot about Broad Street, and we were getting ready to make a motion, and you came in at the end very wisely and said, let me look at it over, weekend and next week. As we talked about maybe pulling off parking spaces from around Walters to Stubby's. We talked about maybe pulling off the whole way, doing something on South Beach Street Extension. Are we any further on that? Any ideas?
Yes. Yes, thank you. We have been working with that. Obviously, we had some issues with some of the longer lines later in the evening. And certainly one of the establishments did decide to close earlier last week. They will be opening up again for later hours starting on Monday. So we're working with them as well. Have taken out more spaces along the South Beach extension that goes alongside the juice bar, between Juice Bar and Walters as well, and have put a great number of stanchions out there. We're going to deliver some, we decided to deliver some sawhorses, so it's something that can be taken down and put up, and perhaps later in the evening, close that street down. We definitely want to keep it open during the day. There's deliveries and so many different access points for different businesses, so probably after 7 p.m., And again, with the Sawhorse weekend, they can, tear it down and put it up against the wall during the day when they don't need it. So we're going to give that a shot. They will again open up again on Monday, I think for later hours. So as I went down there today, we're inching down further down the street with the stanchions and folks down there as well. So hopefully that's providing some relief. So it's an ongoing, as we need to respond process right now. So that's kind of what we're working with.
Jason?
Thank you. Just to follow up, one thing we decided to not make a decision was to see how it went over the weekend. We were going to have a little more police presence and continue to work with all the businesses. Did we find out anything this weekend? Do we still need to look at taking spaces away off of Broad Street by the Stubbies area? Is it not needed?
Yeah, I was out a bunch this weekend and officers and others as well too. Friday tends to be the biggest foot traffic for some reason. A lot of folks last night or whatever it is, but that was a little bit busier. As it gets later, a bunch of those businesses, the bike shops do close, so there's more room on the sidewalk for some of those later night establishments. It didn't seem to be as much of a problem. And again, the pulling back to midnight, everyone was meant to be consistent across the board. Alcohol service stopping at 11:30, things starting to shut down at midnight. It was meant to be consistent and even across the board with everyone. So we weren't creating more gathering spots for a couple hours after those, restaurants closed as well. So that seemed to help too, as well, that whole shift in timing. Obviously, we had one ice cream spot closed on Broad Street later in the night. I went to the others as well, and they kept their lines pretty much over to the side. We're going to have them put up some stanchions as well to help in the same mode too as well. But I didn't see anything too alarming. The people were doing their best to manage that. So nothing too bad from there.
Thank you.
Christy?
Sorry, Jason's comment jogged my memory. So on Friday, we'd also talked about how the governor's orders, we're talking about police being able to enforce some of the governor's orders and masks and stuff. And I know there's been a couple of updates to the select board, but just publicly, could you go over what is expected of the police department?
I will refrain. I don't want to speak for the police, even though I'm in this building. Libby might be able to as well.
Chief and I have talked a little bit about it, but what the governor said yesterday was the local police are authorized to enforce COVID violations. And the goal, though, is not to fine people or issue citations or arrest them. The goal is to get people to abide by the rules unless they refuse to comply. So generally, compliance refusal tends to occur in the later evening hours after alcohol quantities have been consumed. So hopefully we will not have to do this, but he did really emphasize that the goal is not to fine or arrest. It is to, again, educate and urge people to abide. So the department will be responding to calls and doing their best to encourage people to comply.
Any other? Okay, great. So can we move on to public comment for items that are otherwise not on our agenda for discussion? This is the time when anyone in the public can bring something to our attention. Oh, someone has their hand. Oh. Diane Coombs.
Hi, how are you? Thank you.
Go ahead.
Are you hearing me? Are you hearing me okay?
Yes, go ahead.
All right, what I'm calling about, I'm sure you've heard enough about it, is to try to reopen the take it or leave it out at the DPW because of the number of people who are looking for things that they have always had. We're not, many of our people here are not making the money that they did make. Therefore, it becomes more difficult to buy winter clothes, baby clothes, and all that stuff. And we have talked about what to do that would make it good to start it again because, first of all, as the hospital thrift shop and the rest of people like that have gotten more than they can contend with because people can't take it to the DPW, their things. So they take it to the thrift shop, and the thrift shop having the amount. I was thinking, one of the things is how do you manage it? So one of the proposals that we came up to was people who wanted to go into the house would pay $5 a person, or if two of them, $5 for half an hour. And looking at the space and the way the tables and whatever are arranged, that we were thinking 5 people in there at a time. One of the most important things which we have heard about, the reason not to have it is because the viruses that might come in with the stuff that's being taken there. There is an ultraviolet blue light that removes the viruses that a lot of places uses, buses, hospitals, all sorts of people. We should have one actually at the entrance to the dump because many people go and dump their stuff and they're standing close by. So an ultraviolet blue light would be very good. And anything drop-off furniture could be taken to the outdoors and could be dropped there and then moved. The money that we would make on the $5 an hour would go into paying our employees more money than the little they do. And in that vein, we have a program that has the more elderly volunteer help. Some of them work at the DPW and other places that get a small amount reduced from their taxes to work as volunteers. There are lots of people that would volunteer that would like to see this going. And the Salvation Army, we have some program with them that they would take the stuff from the take it or leave it, and which would save us, I understand, going back onto an old post, I think it was $63,000 from having it to go down to Maryland and tipped. So this would save on the tipping price. I think that at this time, there are lots of people that need help. Food is one way of helping, but there are other things that man a house, clothe their children, and do furniture and whatever that can be used in the house. So I would seriously ask you to contemplate what I've mentioned. If anybody has any questions, I would try to answer them, but otherwise I would like to see some thought by the select board as to being able to do this.
Diane, thank you. We will. Thank you. Are there any other public comments this evening? Seeing none, there's no new business that I'm aware of. We'll move on to approval of minutes. Payroll.
Dawn,
Melissa?
I'm sorry, it's Melissa. I had one follow-up question for Roberto before we move on, if you don't mind.
Oh, sure.
Okay, thank you. Roberto, there was some news articles about the efficacy of neck gaiters, and I thought you had said you might mention something about that to us tonight. And updating the public on.
Yes, thank you for reminding me. It wasn't in this PowerPoint, that's also I missed it. Yes, so there's been information, it's a preliminary study that's out by Duke University, a physicist from Duke University that is discussing the efficacy of some masks in preventing particulates from leaving the general area of the face and speaking, coughing, things like that. And what they were finding is that the fleece, specifically the fleece or the polyester neck gaiters are more, they're more likely to break down the larger droplets and aerosolize the droplets from your speaking and things like that into the air, which theoretically can increase the amount of time that the aerosol can stay in the air, increasing the infectivity. So the researcher himself said that all he did was a demonstration that that needs to be researched more before any direct policy is built off around it. But it is definitely something to talk about. So from the very beginning, we were always recommending the cloth masks, neck gaiters were considered some barrier between you and the outside. The recommendation for some people, so from what we're hearing from our state phone calls so far, is if people are going to continue using neck gaiters, that they should fold them over so that it creates a double layer to prevent that second aerosol from coming through. But in the meantime, always cotton, double layer face masks, something like this, or one of these that my in-laws made where it's 2-layer cotton. These are really effective at preventing the aerosolization, and it will keep it in around those few inches around your face. We are recommending right now that if you have access to a mask, even if it is something like this, something simple, or one of those quick surgical masks, to wear those instead of the neck gaiter if you have access, because it is more effective. So thank you. And also, they're also finding that the regular mask that has the vent at the very tip of it, that doesn't block. It does prevent aerosols from going out, but in an area of a recirculated air environment, like an airplane, masks with the little vent will recirculate that because there is no blocking. So try to stay to the 2 primary choices that you're seeing out there. The great majority of people are using these types of masks, so that's great. Neck gaiters aren't as effective, and the way Bill Nye said it was, if you can blow a candle out while still wearing your mask, it's not as effective as you think.
Thank you. I'll move on to approval of minute. We have one set of minutes, of payroll warrants, and treasury warrants. Would someone like to make a motion on them? All
So
three?
moved.
Is there a second?
Second.
All those in favor by roll call: Jason Bridges.
Aye.
Matt Fee.
Aye.
Christy Ferrantella.
Aye.
Melissa Murphy.
Aye.
John Holgate, aye. Next, we have citizen and departmental requests. Habitat for Humanity has a request in for building permit fee waiver. The staff recommendation is 50%, consistent with our policy. Does anybody have any comments or questions? Richard Hussey, I believe, is here for this.
Move approval based on our policy.
Is there a second?
Second.
All those in favor by roll call: Jason Bridges.
Aye.
Matt Fee.
Aye.
Christy Ferrantella.
Aye.
Melissa Murphy.
Aye.
John Holgate, aye. Thank you. Christy, go ahead.
Just a follow-up question. In the AIS, it just mentioned that the policy was never finalized, and I didn't know if that could be something for a future select board agenda so that we could work with the building department on what our policy should be. But I know this is consistent with past habitat practices.
Yes, we can do that.
Thank you very much. We really appreciate this.
Thank you, Richard.
Last time I'll be here for a while.
Okay. Good luck.
Thank you.
Right. Yeah, it seems, sorry, Don?
Go ahead, Matt.
Yeah, it seems the part we have to do is how do we ensure that if we do this and a house is no longer, affordable, that we get the money back. So that's the part that we still have a little bit of work on. Putting a lien on it didn't seem to make sense. Who's going to take care of it? I think we need some recommendations on that. But I think the policy itself is solid. It's the, oversight and enforcement of it to ensure that we don't get out 20 years and go, oh, geez, we forgot. So that's the part that's missing.
Yeah, for it to forever be restricted. but it's consistent with what we've been doing. Okay, next is a citizen petition request to rename Coon Street. Shall I go to Linda Mooney?
Yes, I'm here. Can you hear me?
Yes, go ahead.
Okay. Hello, my name is Linda Mooney. I live at 6 Coon Street, and I want to thank you for allowing me to speak today at your meeting. I'm speaking on behalf of the homeowners on Coon Street. We have put this petition to the town because we feel it is an appropriate and timely to rename Coon Street. While we understand the historical significance of the name to the town and we have deep respect for the Coon family and everything that they have contributed, we also recognize that the meaning of words in our society change over time. Many people are not familiar with the Coon family, and for them, the street name elicits only negative feelings of racism. We recently had to purchase a new router for our home for our Wi-Fi, and we were quite surprised when the Comcast representative told us that we could not use, our prior name was 6 Coon, and she said that that was a racial slur and would not be acceptable. It is a unique time in our country where people are paying special attention to racial sensitivities. We believe this cultural awareness should give the town the momentum it needs and the support it requires to take this kind of action. None of us want the streets of this town to be symbolic of anything but joy. We have suggested a name like Duck Pond Lane, but are also aware that the town may want to choose something of historical significance. Either way, we feel strongly that the name should reflect only the best of our town and should not make anyone feel uncomfortable or disrespected, even if that feeling is attributable to a misunderstanding. We have learned that the Coon families themselves felt saddened when their name became a racial slur, and we think that they would understand the town's need to make this change at this time. We appreciate your time and consideration to this issue. Thank you. Any questions?
Oh, thank you, Linda. I know that Brooke is here. Brooke, you did email me a statement. Did you want me to read it? Okay. Jason's shaking his head yes. Nantucket Equity Advocates supports having an open community conversation about the request via the public hearing process. NEA supports efforts to find a solution that balances respect of the history of the name while acknowledging the current derogatory meaning of the word and the potential harm it does to people who see the sign in passing without benefit of any education about that historical background. And that signed, thank you, Theron Singleton, Brooke Moore, Charity Grace Mofson, Marita Scarlett, Mo Moore, and Chantal Blois Murphy. And I know that Fran Cartoonan did some history. I don't know if shall I turn to you now, Fran? You're muted.
Okay, can you hear me now? Okay. I have three things to present, Madam Chairman. First of all, who the street is named for. I was aware that there was a Nantucket whaling captain named Coon. Looking into the family history, I found that William Coon Sr. came to Nantucket around 1750. He married a Nantucket woman, and so did their son, William Coon Jr. William Coon Jr. and his wife had 9 children, including James Coon, a highly successful Nantucket whaling captain, Charles Coon, who also was a whaler, and William Coon III, who enlisted in the Union Navy from Nantucket in 1861 and served as a gunner in the Civil War. There are 32 individuals with the name Coon in the Barney genealogical record, and there is a Coon family plot in Prospect Hill Cemetery. But there have been no people with the surname Coon on the island in about 100 years. Now, how people feel about the street name. The town manager has received the petition from 6 residents of Coon Street to change the name because they feel the name is perceived as a racial slur as part of their street address. So I informally polled a number of Nantucketers who might be expected to have an opinion on the matter. And these opinions range from wanting to retain and honor the name of a Nantucket family, on the one hand, to feeling that the word coon is a racial microaggression and no street name containing it can be acceptable. Older people who shared their opinion with me were the most interested in the history of the street name, while generally speaking, younger Nantucketers felt they had been wounded over the years by snarky juvenile jokes about the name. Possible alternative names. A letter was received suggesting the street name be changed to Ruth Grant Lane to honor a longtime Black resident of the street. 2 generations of the Grants lived on Coon Street, and they owned a Black-owned business for 80 years. Charles Grant Sr. and his wife, Rachel Grant, purchased the property on South Beach Street that eventually was occupied by the Opera House restaurant. They ran a saloon on the premises until Prohibition, then converted it to a bistro-style restaurant. For a year, they made it available to the Nantucket Boys Club, and after World War II, they leased it to the Guyards for the Opera House. They didn't sell the property until 1969. Charles Grant Jr. was Nantucket shellfish warden for a decade, and Georgia-born Ruth Grant continued to live on Coon Street until her death in 1985. Ruth Grant made her home and her piano available to Josephine White Hall for giving voice lessons and practice. From 1952 until 1996, Josephine White Hall was a fixture of the music scene on Nantucket. She had a long-time connection with Coon Street, was beloved by Nantucketers, and is fondly remembered by many today. So people who originally shared with me their various opinions were positive about retiring the name Coon Street, with public relations explaining the Coon family history and renaming it in honor of Josephine White Hall. Thank you.
Thank you so much for doing all of that, Fran. Are there any comments, questions from the board? The process would be to have a public hearing in regard to this name change, and that's what we're discussing tonight. It's just whether we want to schedule that. Matt?
Yeah, I think we should schedule it. I think we should make a change. I'd like to, something that sort of gives a nod to history would be my, we'll talk about this, would be my, would be my preference, is to sort of still, remove the offensive part of the name, but have a nod to history. I like Ruth Grant Lane. I also have a question for Fran. What was the name of Captain Coon's ship?
He actually commanded a number of different ships. I can't tell you off the top of my head. He also went down with his ship in the end with his son with him. So it was a rather tragic ending to a life at sea.
Yeah, we tried to find the name of his ship because we thought that would be a great alternative, but we couldn't find the name either.
We don't want the name of the one that sunk. That's for sure.
Oh, one of them died in the James Simmons, I guess. Yes.
There's a website, Whaling History, where every ship that he mastered is listed with its voyage and so forth, and I can recover the names.
Thank you. Melissa and Christy. Go ahead, Melissa.
Thank you. I agree with Matt. I think it's appropriate to have a public hearing on this. Thank you, Fran, for all of your research, and to Linda and your neighbors for bringing this forward. Like Matt suggested, I think a creative name that might encompass and point to something in history is great, but I'm sure by the time we get to the public hearing, there'll be some firmer recommendations, and having the public weigh in on it will be important. So thank you for bringing this to us.
Thank you, Christy. Then Jason.
Similarly, I just wanted to agree with Matt and Melissa that I wanted to bring this forward to a public hearing, and I think it would be important to keep the history, but also maybe look at somebody of color to recognize them as a street name. So something that we could think about in that public session.
Jason?
I was just going to say what Christy was going to say. I like to keep it connected to history, retiring that name. We could put something there, some kind of monument that explains what the name was before and why was it changed and when was it changed and why was it changed. That would be a nice monument to keep the history there. But I like putting it to someone like Absalom Boston or someone in the history, if we're going to keep it with whaling. But again, the public, Fran and the community, we'd love to hear from everybody on what that name should be. So I support the public hearing. I think Fran had her hand up.
Oh, Fran, go ahead. Fran, you're muted.
I'm unmuted now. I'd like to say that Ruth Grant and Josephine Whitehall are both Black women. And they actually had something to do with Coon Street, whereas none of the Boston family, Absalom Boston, or any of them had anything whatsoever to do with that street.
Thank you, Fran. I think a motion is in order, or do we just want to?
I'll make a motion. So, second.
Second. Okay, all those in favor by roll call, Jason Bridges.
Aye.
Matt Fay.
Aye.
Christy Ferrantella.
Aye.
Melissa Murphy.
Aye.
John Holgate, aye. We'll get that scheduled. So it'll probably be on an early September agenda. Thank you all on that. Next up, we have, there's a request from Toscana to offload barges at Steamship Wharf between 10:30 p.m. and 7:30 a.m. I think Shane is here for this. Shane Corey.
Thank you, Madam Chair. The reason we're requesting this waiver is that material has been shoaling up on the outside edge of the steamship pier to the point where we're having difficulty getting our barge in place to offload at low tide without running aground. And that's presents a serious safety concern for us and for our crew, that if that barge were to get damaged by running aground out there, it could potentially capsize. And that's a real hazard. So what we're asking for is the ability to be able to offload our barges, excuse me, at night when the tide is high, rather than having to wait till the morning when when it's a low tide. So that would be every other week. This week the tides were high in the morning, and next week they're going to be low first thing in the morning.
Okay, thank you. We have Bob Davis and Rob Raney here from the steamship. Did you have thoughts? Bob, you're muted.
Sorry. I think the situation, it's a hazardous situation, not only for the barge operations, but also for our operations. We are in the process of requesting emergency dredging with the Corps of Engineers and Mass DEP. We'll also have to come to the Conservation Commission as well for that. We have a plan where we can address the immediate needs at that facility, but we are going to have to be doing a long-range plan, and we have our engineers working on developing a full request for a dredging in that area. But that won't be, we won't be in a position to submit that for a month or so. But
Jason?
I think this is a good solution to keep things moving, but just to make sure the public knows, just a couple of questions. Shane, thanks for being here to answer questions. I appreciate it. You said it's every other week. That's good to know. When would it start? When would it finish? Would it go through the whole winter? It's probably not going to be as big deal for the noise in the winter because there's less people here. And then when would the dredging be done by 2021? Would this be through next summer? Just a couple questions.
Well, I can answer the questions about the tide scenario. So, for example, tomorrow it's low tide at 8 a.m. So we've scheduled our barge to get here just at 8 a.m. and start the offload. So we're working on high tide. Next week, we will be looking to start the offload at about midnight on Monday night. The offload usually takes like 5 hours, so we'll be done by 5 a.m. And then on Thursday, will actually be Wednesday night. High tide is at 1:30 a.m., so we would potentially start at 2 a.m. and be done at 7. And then the following week, that would put us back at high tides first thing in the morning, so we wouldn't have to deal with the issue.
Matt? Oh, sorry.
Yeah, just
Finish.
oh, you can finish.
No, I was just going to say, as far as when the dredging, I think that would be a question for Bob Davis.
Matt?
Yeah, I was going to say the same thing. That's a steamship question on the dredging. One question I have for Shane is the backup alarms. I'm just trying to think of what's going to be the most likely thing we may get complaints about. And I'm wondering, would it be the backup alarms be the most piercing in the middle of the night? Can those be turned off if it's only one truck working, or?
I would say from a safety standpoint that the backup alarms need to be operational. I'm pretty sure that's a DOT regulation.
Right, and I've had them on my bread vans. We don't have them now. That's my one, whatever it is whatever you can do to keep the noise down so that we don't get, I'm in favor of this, but we have to be thinking about the people who are living, or renting, sort of on the edge of the harbor. If those any noises that will travel will be what Erica gets the phone calls about. And so I'm trying to think of what can we do to keep those down.
I'm more worried about the excavators dumping 7 dump truck loads of gravel at 2 a.m. In terms of the kind of calls I'm going to be getting.
Typically we're hauling that material to either Arrowhead Drive or Bunker Road, which I think are commercial sites. So I don't see there being too much of an issue there.
Thank you. Jason, did you have your hand up?
Yeah. I think just thinking through, I'm glad Erica said that, of, the big dump trucks take it off, and it's probably not loud during the day, but maybe in the middle of the night, thinking about the water. But I agree with Matt, if we can minimize as much as possible. And would this go through, would this be September, October, November, Shane? Would it kind of go through the fall and winter?
Again, I think that would be a question for Bob Davis or Rob Rennie as far as when they think they can get the emergency dredging taken care of.
Bob?
Yeah, so if I may, so we're preparing the requests for the emergency dredging. We've been informed that procedurally that should be a rather quick process. Once it's issued, it's only valid for 30 days, so we're gonna have to mobilize quickly to get this done. Of course, the cost of that, we're gonna have to seek bids on the basis that it's an emergency, with the time frame that we're going to be allowed to do this in. So, we also have concerns. Obviously, the Eagle berths at that facility at night, and our crews sleep on board. So we'll have to make sure that everything's being done to minimize as much noise as possible, because that would impact the rest period for the cruise, which potentially could impact the sailings the following day. So, we have that issue. And I think the other issue is that we will have to be looking at some temporary lighting to make sure that it's a safe situation there as well. I don't think our lighting at that time of night will be sufficient. So we'll have to look at that.
Christy?
Yes, questions for Shane. What are you guys doing currently right now to unload when you can't match up with the tides, or are you just having to skip over or postpone?
Go ahead, Shane.
So what we've been doing is starting in the afternoon. The problem that presents us is it puts a lot of pressure on our crew to get back to New Bedford in time to get loaded for the second load of the week. We only have 2 days or 4 days to operate. So leaving here late on a Tuesday, it's difficult to get loaded up again on Wednesday and get back here on Thursday. And just to address the question of the lighting, we do have a portable light tower that we'd be happy to set up on site, and we'd be willing to work with you in any way we can to minimize the noise at site too.
Matt?
Is the 4 days an issue from your side, or is that from Steamship?
It's the steamship, so we can only work there Monday, Tuesday, Wednesday, or Thursday right now, and the Monday slots are booked by Lawrence Lynch. So that's where that 4 days comes from.
Kristen?
So the nighttime work would just be Tuesday, Wednesday, and Thursdays?
It would be Monday night into Tuesday morning and Wednesday night into Thursday morning, and only every other week.
Thank you.
And I'd be happy to email Erica or whomever you like, or schedule a week ahead of time if necessary.
Thank you. Matt?
I'll make a motion to approve it, and and we'll see how it goes.
A second.
Okay, by roll call vote, Jason Bridges?
Aye.
Matt Fee?
Aye.
Christy Ferrantella?
Aye.
Melissa Murphy?
Aye.
John Holgate, aye. And if it becomes a problem, we'll revisit.
Thank you.
Thank you.
Thank you.
Thank you, Bob and Rob. Next up, we have the Nantucket Historical Commission, a review of their mission. Hillary, I'll turn this over to you.
Thank you so much, Madam Chair. Thank you, everyone, for hearing from the Historical Commission, making time for us. I'm very pleased to be here to present the revised mission and also introduce the priorities for our commission. Also present is Holly Backus, our town preservation planner. And I see Andrew here as well, Andrew Vorse, Director of Planning, with who we also work. We have a presentation. Is it possible to put that up on the screen and I can talk through the presentation? Thank you, Erica. Okay, Erica, you can advance it. Terrific. So the Nantucket Historical Commission has been appointed for just over a year now, but it was actually introduced and adopted by an overwhelming majority at town meeting in 2005. And it was sponsored by Aaron Markovich. This is something I found out by looking in the Inky Mirror archive just to get a little bit of the history at the time. Aaron was an assistant HCC administrator and felt that in addition to the Historic District Commission, Nantucket would benefit from having a historical commission that would be focused on preservation planning and surveying the historic assets. So that was the motivation then to increase funding for planning and surveying historic structures and archaeological sites. Our enabling legislation is actually part of Massachusetts general law. It's section 8D of MGL 40. And as I mentioned before, we were reactivated and fully appointed by the Select Board in 2019. So we just celebrated our 1-year anniversary. Next page. So we are a group of 10 people, 7 commissioners and 3 alternates. The group has 3 architects with preservation-oriented practices, 1 member of the real estate community. We have 3 individual board members who have extensive experience working with preservation nonprofits over many years. We have 1 alternate commissioner who is a trained archaeologist. And we have 10 folks who are enthusiastic and volunteering a lot of time to further the interest of preservation on Nantucket. And of course, we work with Holly Bacchus. You could advance the page, great. You know, we're 10 people with a lot of energy, experience, and enthusiasm, but we also recognize that there's a tremendous group of people on Nantucket with very relevant experience in and advanced degrees in preservation and in architectural history. So we've actually formed an advisory and resource board to help us with specific issues and advise us. And you heard earlier from Dr. Karchunin. Also, Betsy Tyler has joined this group with a lot of direct experience in researching and documenting the history of houses. Michael May, the former head of the Nantucket Preservation Trust, is a member of this board. Mary Bergman, the current director of the Preservation Trust. Marty Hilton, who's the director of the Preservation Institute. Brian Pfeiffer, an architectural historian who helped prepare our National Historic Landmark document and has documented many homes on Nantucket. And Penn Austin, who is a extremely skilled preservation builder practicing on Nantucket for over 30 years. So we worked on putting together our mission statement. I'd like to read it for you, and there are a couple things just to emphasize about it. The Nantucket Historical Commission serves the public by protecting the National Historic Landmark of Nantucket. Nantucket's period of historical significance ranges from the settlement period beginning in 1659 up to and including the preservation-oriented revivalist development of the Beinecke period, ending in 1975. Historic assets include not only the structures erected from 1659 to 1975, but also the setting and context of these structures, the American and Native American artifacts, and the island's special visual quality as expressed in the natural and built environment. The NHC advises the Select Board on matters of preservation and works with Nantucket's preservation planner, planning director, and other municipal agencies. It creates plans and guidelines for historic preservation, directs surveys of buildings and lands of archaeological and historical significance, and advocates through the Select Board on issues of historic preservation. The NHC complements the local Historic District Commission, which is Nantucket's regulatory architectural review board. It also liaises with the Massachusetts Historical Commission and local preservation and conservation nonprofits. So a couple things that are notable in this mission statement are defining the periods. These are lifted specifically from the National Historic Landmark document, which catalogs the contributing periods of Nantucket architectural activity. The inclusion of American and Native American artifacts, the items in the ground, and also as the whole island is a National Historic Landmark, this, what we call and what is called in the document, the special visual quality of the landform is noted. Importantly, we advise the Select Board, so we advocate through you. We're here for you as a resource. And we also complement and work with the HDC. The HDC is an architectural review board paying attention not only to preserving the important aspects, contributing aspects of the older structures and very old structures, but also making sure that the new structures, which aren't at all historic, blend in to our National Historic Landmark. It's a very different and complementary role to the Historical Commission, which deals with things that are older and are historic and contributing to our landmark. Eric, if you could move forward. So just building a little bit more on historical commissions versus historic district commissions, you know, Nantucket was unusual. Nantucket and Beacon Hill simultaneously became the first historic districts in the Commonwealth in 1955. And actually, that special act and designation predated the creation of historical commissions. Historical commissions started to be created in the 60s, but normally in Massachusetts and across our nation, a community, a town would create a historical commission and then would designate certain areas to be historic districts if that was needed or important. So there are 351 towns in Massachusetts, and there are 340 local historical commissions in Massachusetts. Not every town has a historic district. There are about 220 local historic districts. But the important thing is that these two groups together complete the preservation function of a town and complement each other and work together, or ideally work together. Next slide. This information comes from the Massachusetts Historical Commission, which has outlined the typical functions of historical commissions. Of course, every town needs to decide what their town's historical commission should be doing. But in our case, surveying was top of the list here, and surveying historic properties, historic structures, burial grounds, landscapes, nominating properties to the National Register of Historic Places. Interestingly, Nantucket has only 5 properties on the National Register of Historic Places. It's mostly the lighthouses and the Jethro Coffin House. So there are many, many more properties that we might want to nominate to the National Register of Historic Places. Planning for rehabilitation of municipally owned property is something historical commissions often get involved with, including sourcing grant funds and applying for grant funds for that work. Reviewing federally and state-funded projects for local impact. So every project, new project like a road or bike path or a wind farm that has state or federal money that impacts a historical commission, a historic district, does need to be reviewed, and it is typically the historical commission that would do that review. We've completed 2 of them, and we're involved in a 3rd right now. Educating the public. Nantucket has such a long history of nonprofits, of preservation nonprofits, the NHA and the NPT and the Sconset Trust that do a lot of education, but that is something often historical commissions in other towns would do. Advising the select board, the planning board, the HDC, other local leaders, and proposing legislation for the protection of historic assets. Nantucket has quite strong legislation protecting our historic assets. We have, of course, our special act for our historic district. We also have a preventative maintenance or demolition, aka demolition by neglect law, but we may need to revise these. We may need to create new. We may need to change existing bylaws, and that would also be something that we would advocate through you, the select board, to do. Next slide. So what have we done to date? We've been active for a year. We've worked a lot during our first year on advocating for rehabilitation of the historic streets and sidewalks, building awareness that this historic paving material is a historic asset, requesting a historic streetscape survey, which is being delivered by NPT and the Preservation Institute Nantucket and funded through CPC funds. That was awarded at our most recent town meeting. We've also requested a preservation engineering study, and this was commissioned by, this is a little bit of a breaking announcement, by the Community Foundation, which has set up a Keep Nantucket Real Project Fund, which is paying for this preservation engineering study to help provide additional information to the town, to the DPW, and will accept continued donations for that and other preservation projects. We developed phase 1 guidelines for rehabilitating historic pavement, submitted these to the DPW. We're continuing to work on these, and we have final guidelines targeted for September, which will be delivered along with this independently funded preservation engineering study. So maintaining the historic pavement, recognizing its importance and contribution to our town has been an important initial initiative for us. And we've worked closely with you, our select board, with our DPW to do this, brought resources to the table through our advocacy, and hope to really come up with something that is agreeable to everyone to keep these important materials here on Nantucket in good shape and accessible in everybody's. We also did an impact review of Milestone Road, the safety and accessibility project, which is now been completed. We advocated through the select board for some changes to the curbing, preferring granite curbing, and also a reduction in signs. And the select board, you all last year forwarded our recommendations to the DOT. And I'm very pleased that of the 105 signs that were planned for that road, they removed 51 of them. 51 of them haven't gone up. Now, I haven't had official news. Perhaps they are going up, but I think at this point, the signs are pretty much done. So we felt that was a contribution to our community in terms of reducing signage clutter through our review. We also did an impact review of the Bartlett Road roundabout. And that roundabout is no longer in the works, but we did take that work and produced a report called Roundabouts with Nantucket in Mind, which we'd be very pleased to present. It's on our town website. It's available at any point. We think it has a lot to offer the select board and the planning department some advice for you all to consider about the styling and designing and use of roundabouts. Next slide. So what's next for us? We've updated our mission statement. We have a fully appointed commission, and we've spent some time going through all of the different things that might be a big goal for this next fiscal year and beyond. And working with Holly together, what we've come up with as our big priority is updating Nantucket's historic surveys. These are the surveys, the inventory of our historic structures. The last comprehensive survey of Nantucket's historic structures was over 30 years ago. The forms and the information are now out of date. They are kept in the Massachusetts Cultural Information System, known as MACRIS. And in that database, there are 2,895 building forms, cataloging structures on Nantucket that were completed, most of them 30 years ago. Some of them are more recent. But we believe that that you can't preserve something if it isn't documented, isn't surveyed. So updating these surveys is important. And that's really our big next goal. I mean, we're working on lots of other things, but updating our surveys is our big next goal. And in order to do that, there are a couple steps. We would like to become a certified local government. A certified local government is a designation that is bestowed on a local historic commission, well, really on a local town, by the Park Service and the Massachusetts Historical Commission. Excuse me. There are 25 certified local governments in Massachusetts. Sorry, I've got a frog in my throat here. In order to do this, we will need a memorandum of understanding between the HDC and the NHC, and ultimately will require the signature of the select board. So this is something we're working on right now. And ultimately what it would mean is migrating our surveys to using the MHC inventory form. So I wanted to talk a little bit about that, have some conversation about that, and really talk about our communication plan with the select board and hear what's important to you. Hear what the select board thinks about when you think about preservation on Nantucket, maintaining our historic assets, our special quality of our town. So I'm going, Erica, you can stop sharing this slide, and I'm going to stop talking and hope my voice recovers. And I would love to hear questions from you, comments, and open also the floor to Holly if she has any additional comments.
Matt?
Yeah, I think I've been really impressed with your committee. I think you guys have done a lot of great work in a short period of time. And I think the board that you've compiled to, sort of advise you is pretty incredible as well. You guys are to be commended. I think, for something that we thought we didn't even need. A year later, we realize how, at least I realize how, I think we all do, how important it is and how much good work you guys can accomplish. And so I want to thank you. The question I had is who writes the MOU? What would the MOU between, Historical Commission and HDC, what will that entail? Who writes that? I'm all in favor of doing this, but how do we do it?
So when this came up, we reviewed, the application to become a CLG and what we had to do and tried to figure out, would this be difficult for us to do? What would it obligate us? We talked about it at length in our committee. We talked about it with Holly and with Andrew. And it's actually really not complicated to apply. The MOU is a checklist item. So we reached out to the Massachusetts Historical Commission. They have a local government coordinator. And what we found was that there are some, forms, some boilerplate forms. So we have an MOU that has been sent to us to base our version of the MOU on. And it basically just says, the HDC, the local HDC does what it does. The NHC does what we do, and that we coordinate. We meet at least annually. We think in our case, it's probably going to be more than annually, but that's really the basis of the MOU.
Thank you. I had a question about, I agree with Matt, you've been putting a tremendous amount of energy into this, and it's a great group of people. And the advisory is a wonderful list of people with tons of experience. But I was just a little bit concerned about it being called a board. Are they having meetings? Organized meetings? I thought that they were a group of individuals who could provide advisement to you, not necessarily that they would be a separate group that was being created to meet.
Yeah, that's a fair comment. They're a group of individuals. We can call them a group.
Well, I just wouldn't.
They don't meet separately. So to answer your question, they are welcome to join our meetings whenever we meet. We make a special, all our minutes are open, all our meetings are open, but we make a special effort to invite them. And if we have specific questions, for instance, for our next meeting, we're going to be talking a lot about surveys and migrating to the use of these in-forms. So we've made a special request that people like Betsy Tyler and Marty Hilton and Brian could join us for that meeting and advise us.
Thank you for clarifying that. I think it would be good to have it be a list of experienced advisors rather than a
sure. We can call it a separate.
I do see a question from Rick Atherton. He has his hand up.
Hi, Rick.
Okay, Dawn, can you hear me?
Yes.
Great. I just thought it would be helpful to explore what an MOU is. Is it a contract, a memorandum of understanding with intent with no legal force, or what is it? And the reason I'm asking is that I think the select board or prior board of selectmen has entered into a number of MOUs, and it wasn't always clear, even to me as a member of the board, what the legal substance of those understandings were. Thank you.
No, thank you. That's a fair question, I think. I'm not I can actually fully elaborate on it. Hillary, did you have a comment?
Did Rick want me to answer the question about the MOU, or was that a question for the board?
I think it was, if you want to shed some light on it, but I think it might have been a little bit from the town's perspective, what the level of obligations are. We don't have counsel present. I don't know if Libby or Andrew wanted, or Holly wanted to address that.
Holly, I think Holly is probably the best person to address that.
If you don't mind, Holly.
Yes, Madam Chair. The Memorandum of Understanding is basically an agreement between both commissions And then essentially the select board, you all would be signing off on it. But basically it outlines the requirements and responsibilities of the CLG between not only the commissions themselves, their responsibilities, but also a staff member who would be a coordinator, probably somebody like myself, on behalf of the town. But the responsibilities of the Historic District Commission are exactly what they do, and this is all outlined in the MOU. I did reach out to the MHC to make sure there wasn't any other boilerplate MOUs that they use, and this is what they use. There's no other ones. But my understanding is we need to make sure that there's no issues with our town charter, and that has been reached out to town council that we're waiting response back on. But the responsibilities for the HDC would be enforcement of local preservation legislation. They do that. Holds meetings at regular intervals at least 4 times a year. We know they exceed that. Properly notices and conducts meetings in accordance with the open meeting law and the local preservation ordinance bylaw, makes decisions in a public forum, maintains accurate minutes of all commission actions, which include criteria upon decisions that were made, and holds annual joint meeting with the local historic commission to discuss respective responsibilities of the HDC and the Historical Commission for Local Preservation Program. And similarly, the same thing for the Historical Commission is outlined as well. Hold meetings on a regular intervals at least 4 times a year. The Historical Commission meets every month. Properly notice and conducts meetings in accordance with the open meeting law. There's members of the commission that handle all that. Makes decisions in a public format. Maintains accurate minutes of all commission actions. They do that. Holds annual joint meeting with the local Historic District Commission to discuss respective responsibilities. I will say that both HDC and the Historical Commission met for the first time really in June 30th. And I think that was a really robust, very productive meeting. And I think they both were amicable to doing that continually. Allows reasonable opportunity for public comment on properties proposed for nomination to the National Register. Prepares eligibility of opinions for properties proposed for nomination to the NHR. And maintains local inventory of historic cultural resources. And the copy that I have available, which obviously can provide to you all, is a copy from the Gloucester Historic District Commission. I've also reached out to the Massachusetts Historical Commission to make sure that we're clear on the guidelines for the implementation and make sure the document that I was looking at, that's about 30 pages long, was up to date. It's from 2016, and I got confirmation from the CLG coordinator for the state that it is up to date. Really, it gives the requirements for the program, the process from the local government's perspective, the monitoring, transfer of historic preservation funds. The biggest thing that the certified local government would provide to the town would be federal funding that we wouldn't be otherwise eligible for. And I think that's something that the town would possibly appreciate to be available to us. So thank you.
Hillary?
Yes, and I just wanted to clarify that the reason why there's the application requires an MOU is that the federal funding for preservation planning is distributed to certified local governments. So by becoming a certified local government, we get preferential access. We can apply for these grants anyway, even if we're not a certified local government, but in certain years, the funding dollars are only distributed to certified local government. And one can expect that those would be years when funding is tight and that we might possibly be coming into some years like that. So it's really in our interest, if we want to get started with these survey updates, that we become a certified local government. And it's just something that the federal and state governments, they don't hand it out without making sure that you meet their expectations for performance. And you meet their expectations of performance by having certain policies and procedures in place and demonstrating that you can have open meetings, that you can maintain minutes, that you can really be responsible, be a responsible agency, and also that if you have more than one, not every town has both a historical commission and an HDC, a historic district commission. Some do both of those, architectural review and preservation planning, through one agency. But if you have two, the federal government and the state government want to see that those two are working together and are coordinated, and that the right hand and the left hand know what each other is doing. So that's why they require this MOU, which is not a legal document. It's just exactly what it says, a memorandum of understanding that everybody needs to sign to say, hey, you know, we talk to each other.
Jason?
Thank you, Madam Chair. It's a great presentation. I think it was needed to see everything that you guys have been doing and moving forward. It's not just weighing in on a couple projects, right? It's much bigger than that. So what I'm going to say is things that Hillary and I have talked about before, and I wouldn't say we argued over before, but we had discussions on the role of the NHC. And my only concern, and like I said, I've already said this to Hillary, so this isn't anything new, is the scope of the commission, right? It's an advisory board. It's not the HDC. It's not an advocacy group that's outside of the town. It's working within the town. So there could be situations where it could be advocating for a project or against a project and going on social media and going to the state to stop a project, which would be, I think, problematic. It may never happen. I just want to kind of have that conversation now in roles and scope, and maybe that is part of a role at times. And I mean, if Hillary or Matt probably chomping at the bit to answer that, and Holly, kind of what is that role there?
Hillary, go ahead.
Yeah, so I think that gets to, you know, the communication plan with the select board. I mean, we advocate through you. You know, you've appointed us. You could choose not to appoint us, you know, to appoint different people, and we're grateful to be here. We respect that, and you know, we're a new commission. We're the new kids on the block, so we're looking for feedback. We're also looking to hear what you want us to work on. Ultimately, we do have to fulfill our mission. So, you know, could we be on opposite sides of the table? We would certainly advocate to protect the historic assets of Nantucket and do our research and our homework and come forward with our point of view. That's, you know, that's what we're here for. We know that this commission will listen to us and think, you know, reflect on what we say. You may not choose to do what we say or agree, so we recognize that. But I think along the lines of communication, I did want to ask, there are many commissions and committees and boards. I know that's now being reviewed about how those are appointed and how they work, and I think it's terrific that that's being done. Some of them have, you know, a designated member of the select board that is sort of the point person. And, you know, one way to address one of your concerns, and one thing that would be very welcome from us, is to have somebody from the select board, our designated liaison, a person who would be coming to our meetings. We meet once a month. Sometimes we meet more frequently if we have to call a meeting to deal with something that's come up. We meet once a month for about 2 to 3 hours. We love to have a representative from the select board. I think it would go a long way towards our working together well.
Oh, Matt?
Yeah, I'd love to have them. I'd love to have a group that researches well and understands, you know, the right things to do, sort of warn us when we're going to do some boneheaded decision. You know, I want them there when we're going to make a mistake, saying, geez, you guys might be making a mistake. Here's why. You know, I think that role is vital. I mean, I'm the old man on this committee now. I've seen too many historic buildings, you know, torn down, or, you know, just, you know, and the advice of, you know, of preservationists ignored. I'd like to see that strengthened. I think our economy, our entire island is dependent on that being authentic and real. And, you know, and we we make a huge mistake when we start to veer from that and forget that. So I think that, Aaron talked about this when he did it in 2005. He talked about the importance of the federal dollars. He talked about, the role. And I think, I'm really excited that we have a group as good as this group willing to take that on. I think it's a huge positive for Nantucket.
I'm 100% supportive of updating our surveys. I want to figure out exactly the best way to do that. I do believe that they're outdated. But I also 100%, and I've told this to Hillary, I want to make sure that the HDC and the Historical Commission both want that and agree on the process for that. The HDC very much has the role of protecting our historic assets and approving changes to buildings. And I would not want to see these two groups ever be at odds on that in terms of their roles. I would be happy with some reservations of adding it to my schedule, but if you all want me to be the liaison to attend some of their meetings, I could do that. I mean, I have the long history on the HDC, so it might be a good fit. Holly, you've got your hand raised.
Thank you, Madam Chair, and that would be fantastic if you could have the time to provide to us. I just wanted to mention that the imperativeness of the HDC and the Historical Commission working together to update the surveys is paramount. And I understand, federal funding, if it's there, let's do that. And this is a way of doing that instead of going through our local channels. And I think that it's pretty much understood that we want to have I personally as liaison between both commissions, want to make sure that both commissions are happy in moving forward with an MOU. But at the end of the day, it is up to you all, the select board, with obviously our town council's support on that. Just wanted to mention that point. But the only way for us to really protect our historic built environment as a National Historic Landmark is to update those outdated surveys. Time and time again, that we come to find out that the information isn't accurate, even on our local surveys. And it just takes sometimes a couple of minutes to research. Sometimes it takes a lot to research. And that is something that definitely needs to be done. So I appreciate talking about this.
Rick Atherton has his hand raised. Rick?
Sorry, there we go. Dawn, no, I was just responding. I think the cooperation between the Historical Commission and the HDC and the Select Board is a high priority to make sure the community is represented through each of the entities we're talking about, protects our historic assets. My initial reason for selecting the hand for an additional comment was to react to Jason's discussion, where he seemed to imply that the board takes priority, and they may well, technically, but there can always become conflicts between state guidelines for the Historical Commission and the Select Board. And I would hope that we don't come to conflicts, but if we do, I hope the Select Board will respect the priorities and mission established from the state for the Historical Commission as well. Thank you.
I think that this was a great initial discussion on mission. We do have a bunch of other things on the agenda tonight, and I'd love to, get some more input from the HDC and from council in regard to certified local government. Matt?
Well, can we have a motion to, reach out to council and HDC and try to put this thing to bed in the next couple of weeks?
Libby, thoughts on that?
I'm not sure what we're putting to bed exactly, but the becoming a certified local government, I respect and appreciate what work has been done on this, but in my experience, we need to be really cautious about what that exactly means, if policies and procedures and operations and resources need to be redirected or changed. We need to know that in advance before we go down that road. We've gone down a couple of roads when we thought it was a great idea, but nobody had thoroughly researched it enough, and then we discovered there are fees to be paid, and there are people that have to be hired, and there are reports that have to be prepared. We're going into a year that is very bare. We don't have extra resources. We have a lot of other priorities to get to right now. I know this is probably one, but we gotta pick what our priorities are, because there's a lot right now, and this is seemingly a new one. So I'm not saying let's not do this. I'm just saying we need to really research this carefully, determine exactly what the impacts are.
And that, if I go on, yeah, and that's my, that's my point is, not I don't want to end the meeting tonight and then be a month or two later saying, geez, are we going to do this or not? If there's work that needs to be done, how can we find out, make sure there aren't any landmines like you're talking about, Libby, and make sure that this is a positive thing and move forward with it.
Libby, then Hillary.
Just quick adding, that's good to hear, but this can't be done in 2 weeks. So I'm just, we'll move along with it certainly, but it might take a month or so.
Hillary?
Yeah, and it doesn't need to be done in 2 weeks. So there's a very clear process. It's an application. The timeline that we're sensitive to is these grants or applications for grants are due in November. So I think if this was something where we've actually gone through the application, and Libby, knowing that, having heard in the past, paid attention, and knowing that I know when the green communities came up, the question was, well, what's the encumbrance for the town? We did review that, and we did summarize that in a presentation, which we made to Andrew and to the HDC. So we could take that presentation and share it with the select board and try to get everybody aware and comfortable in the same way we're aware and comfortable. And I think if we did that in September, that would be fine as far as the timeline, or, even end of September. We do need to get the MOU processed by the HDC. They have a very full schedule. They meet over 5 times a month on average for 4.5 hours every meeting, processing applications. It's been hard to get them to pay attention, but I think if we could have a shared goal and you were receptive, we could get this sort of lined up to discuss again in time for us to apply for some grants, if that was something Holly and Andrew were on board with.
Libby?
I just don't want to raise false expectations here. Again, our resources are very, very stretched, and it is going to take some time to go through this. I'm not sure it's appropriate for the group putting it forward to give us what the impacts are going to be. I'm sure that they're not going to be any different than a review by council or Andrew or I or whoever, but it's going to take a little time. I wouldn't want to commit to September without the board's understanding that other things are going to have to drop aside then. I'm getting ready to get a town meeting timeline going for you, and the budget and the capital items, all the usual stuff that would have happened months ago had it not been for COVID. It has affected everything.
Dawn.
Andrew?
I just want to, emphasize what Libby just stated. We, before COVID, town administration and your board supported funding the the survey update, and we really did appreciate that. Unfortunately, that and some positions here at Plus, had to be cut due to the shortfall in revenue. And I have some concerns about some of the new language in this mission statement. I'm concerned about things that people think they know what it means when there's really not a clear definition. This has been something I've raised numerous times. So I want to spend more time with this. I know that I spoke to the chair of the HDC, and he had similar concerns about it. I think 1975, Holly has explained this to me numerous times, and I get it. And maybe I'm dating myself, but I'm still struggling a little bit with 1975 as a historic landmark date. I think there are certainly important buildings, but I think there's many, many not important buildings from that time period. So I'm not comfortable with this mission statement yet. And, I would ask the board to take its time. And as Libby said, there are many, many priorities right now competing for this. And I personally find this Zoom, I know we're getting better at it, but it's not the easiest way to, I think, engage in a sort of give and take conversation. So that's where I'm at.
Thank you, Andrew. I don't even know when the HDC is available to meet again on this, but I think that we're willing to continue to discuss the idea, but Matt, go ahead. You have a comment?
Yeah, my point is if we don't make a deadline, this will get pushed and it won't happen. And so, I think we have to show the HDC that if this is a priority for us, it doesn't have to be 2 weeks. It can be a month or 2 months, or we could ask staff to come back with what will it take to research this, spend a few minutes to know what it will take. But I just think I've been on too many boards where these things, where this type of thing, ends a good, it sort of is to really just let something slide. I don't think we should. I think this is really important.
Holly?
Thank you, Madam Chair. Just quickly, the HDC, as Hillary alluded to, we've been extremely busy through Zoom, 4.5 hour meetings, just about 4 hours to 4.5 every week. And they do have it on the bottom of their agenda under other business to discuss. But as you can imagine, once 9 o'clock hits, it's a long night. They only have and I apologize for not knowing exactly their schedule, but they only have certain time frames in the year that they set aside for organizational. They want to discuss a few things like this, but again, this also goes to nod of how busy they are. They are, I would say, one of the busiest in the Commonwealth. So just mention that. Thank you.
Hillary?
Thanks. I also just want to say that, we're here, we're a resource for this town. We're volunteers, and we are here to get feedback, to have a dialogue. We presented this mission statement 6 weeks ago at a joint meeting for the HDC. And Andrew, I'm appreciative of your comments. It's the first that I've heard them. We're happy to have you at any of our meetings. We're happy to have many conversations about the mission statement, but we do want to feel respectful of the volunteers' time, respectful of this board, and moving forward and working on something. We're talking about things that have a long time horizon. It's going to take us years to complete this survey. Even if we're not a certified local government, we can still apply for grants. This is a funding vehicle, so we are just looking to bring money to Nantucket to do the work to preserve what is a national historic landmark. If it takes another grant cycle, or if we apply and we're not a certified local government, I'm sure we'll still be here willing to do the work. But I do appreciate the support of the board, this board, which this commission reports to move things along in a way that is not burdensome. We're here to facilitate it. We're here to do the work, and that's what we'd like to get done.
Thank you. What's the pleasure of the board? I think that we can give some direction to continue to research this, and it can't rise to the top, but we can definitely make it something on the priority list. Jason?
Is there a way to just to bring it back in a month, just to get an update or whatever time frame we think, so it's not what Matt's concern is that it's just going to be lost, and we'll 3 months from now will be in the same place. So maybe we can't, there's funding issues, so we can at least bring it up in a certain amount of time. Does that help?
I think that that's fair. Put it on a meeting mid-September. We don't have a meeting the last 2 weeks of August, so later in September. Matt?
Yeah, I'm happy to have it back on in a month, just so so we don't drop it. And when I hear some of the issues with the HDC themselves, I when I hear how long their meetings are and they're not even able to get to this stuff, I think in my mind, I think that some of that not this year, but I'm not saying that, but some of that it gives me pause to want to do this even more. I got on the board 15 years ago, and some of the HDC was overwhelmed and et cetera. And we talked about it, and there were going to be things that were going to happen. We were going to update built with Nantucket in mind, and we were going to look at how else could do it. The Novak report came out and talked about sort of the how overwhelmed they were and made recommendations. But I think sometimes you need more, and none of that's really been implemented because we're too busy to implement it. I think that I look at this group as complementary and might be able to dig into some of those issues for us, not this year. Hillary, don't get scared. But I think in the future, this group might be a great resource to get some of those things done that, I wanted done 15 years ago. So, I'm more than happy, Jason, to have it happen, to readdress this in a month. But it's great.
Okay, so let's plan on that if that's okay with everybody. I don't think we necessarily need a vote. We'll just commit to that. Hillary, thank you for your time tonight and the well put together presentation. Holly, Andrew, thank you.
Thank you very much. And Madam Chair, I also wanted to say thank you for volunteering your time to be a point person on our commission. And I look forward to following up with you on that. And thank you all to this board to working through very difficult times, getting so much done in this format that we have. And I really appreciate it. Thank you so much. Bye.
And keep us updated on when the HDC and the Historical Commission will be able to meet again. I know it's tough. It's going to be tough with scheduling.
We will. Thank you.
Thanks. Next, we have public hearings. We have some utility petitions this evening. I will open a public hearing for 2 Acromuck Way, New Lane and 2 Acromuck Way. Simon is here for this, right?
Yep, I'm here. Yep. Hello. How's everyone?
Good.
Yeah, I'm just pulling up the schematics and the design for Acromuck Way. Is that what we're doing first? Acromuck, yeah. Okay, so generally, I see in the design, we're just installing a handhold right next to the existing pole, and that would decrease the secondary connectors on that existing pole, and we're gonna go under that and connect them, the new residential home and that new handhold. So this petition is for that additional handhold that we're gonna be putting in.
This is a public hearing. Is there anyone here from the public who wishes to speak on this matter? Seeing no hands, I'll close the public hearing. Oh, sorry, wait a minute. I won't close the public hearing. Dave Finley.
Yeah, just is there anything schematically on what it'll look like, from the ground level? This is the bird's eye view, but do we know, what it'll look like? What's going to be hanging on that pole? Are there cans on that pole with electrical transformers? Or is it just holding up lines? I'm just more wondering about the kind of the aesthetics from the, from the ground level, looking across the street. Thank you.
Thank you.
It's an existing pole. Right now, it's everything on it is that I see a permanent riser. So it feeds a certain customer right now and has a cutout. So not necessarily a transformer. So this new additional handhold will basically, it will be underground, ground level. It's just a 17-inch by 30-inch handhold, ground level, and it's basically you won't see any changes to this area.
Simon, isn't it similar to what one of these handholds here in this picture is that I'm sharing?
Yep, it's more the gray one on the right. I think it's more.
It would be like this by the pole.
Right.
Oh, okay.
Yeah.
I don't know if I'm on mute. I misunderstood maybe what the entire thing was. If it's just it's more of a cover on the ground. Okay. Good.
Right.
Thank you.
Okay, if it's all right, I'll close the public hearing now. I don't see any more hands up. What's the pleasure of the board?
Move
Second.
Approve with conditions.
Yep, with conditions.
All those in favor by roll call. Jason Bridges.
Aye.
Matt Fay.
Aye.
Christy Ferrantella.
Aye.
Melissa Murphy.
Aye.
John Holgate, aye. That passes unanimously. Next up, we will open a public hearing for 28 Eel Point Road. Simon, did you want to go over this one?
Yep. Similarly, this is for a residential customer, one customer, and this is a little further in. Right now, I see the existing pole has like a public road on the right side, so I'm sure this is the reason for putting in the 40-foot 2-inch pipe and petitioning for that length, and then going into the customer property and continuing on into a transformer pad and leaving that home to that. So this petition is for basically that 40-foot conduit across that little driveway.
Are there any public comments on this? I'm not seeing any hands, so I will close the public hearing. Board, pleasure.
Move approval. There was no comments from staff.
Second.
Just before we vote, just one question on a couple of these. It said there was planning had no response, and then in the third one they responded. So my question is, when they have no response, Erica, does that mean they didn't get back to you or they didn't have concerns?
Sorry, Katie sends these out, and my understanding is if it says no response, it means that they weren't gotten back to. Usually she'll say no issues if there's nothing wrong with it.
Yeah, I wish I had asked when Andrew was still here, but.
On the other hand, if there was an issue, it might have also said it, because sometimes it can mean no response, can sometimes mean no issue.
Yeah, and I think these are fine, but I think we should clarify that on the documents that we're getting. And if staff isn't getting back to us, then we need to sort of address that at some point.
Okay, that's fair. Is there a motion? Oh, you made a motion. Sorry. Roll call vote. Jason Bridges.
Aye.
Matt Fay.
Aye.
Christy Ferrantella.
Aye.
Melissa Murphy.
Aye.
John Holgate, aye. Thank you. Next up, we have another utility petition at 44 Center Street.
Madam Chair?
Yes.
We are recommending that this public hearing be continued to November 23rd to give the DPW department, the planning office, and National Grid time to discuss the plans. There was some issues with how many handholds should be in that area and if they can be consolidated.
Can I get a motion to continue the public hearing to 9/23/2020?
So moved.
Second.
All those in favor by roll call. Jason Bridges.
Aye.
Matt Fee.
Aye.
Christy Ferrantella.
Aye.
Melissa Murphy.
Aye.
And just fix the spelling of Center Street. Yeah. Next up, we will open a public hearing for 49 Sankaty Road.
Hi, this is Simon from National Grid again. Oh. And this one also a single residential customer. And this one, the customer will provide the handle and conduits across the street to the existing pole. So that conduit, I think it's about 40 feet across, and then so 75 feet total is listed in the design of conduit, and that is what we're petitioning for, and the additional handle, and then we'll run our secondaries to connect the customer.
This is a public hearing. Is there anyone wishing to speak on this matter? Seeing no hands, I'll close the public hearing. The pleasure of the board.
Motion to approve with conditions.
Is there a second?
Second.
All those in favor by roll call. Jason Bridges. Matt Fee.
Aye.
Christy Ferrantella.
Aye.
Melissa Murphy.
Aye.
John Holgate, aye. That passes unanimously. Next, we have select board reports and comments, continued discussion update as to racial equity, race relations task force and community forum. Rachel, we'll go to you.
Yes, thank you. Good evening. I have a couple good updates to provide. One, I will start with the request for proposals. We, I think, are extremely close to being able to advertise that. We have had the Nantucket Employee Empowerment Team, internal staff, a few external, as well as the Council for Human Services review this. And I will be able to circulate the next, I don't know, we're probably on version 7 or 8 or by now, to other members of town admin and the board for one last final review. And then we will probably wait. I would like to hopefully get this advertised by the end of the month. And then based on procurement timelines, we would be looking at potentially end of October, November, when maybe this could be awarded if all goes well. And I will turn it over to Brooke Moore in a little bit. And she is the chair of the Council for Human Services. So I'm going to allow her to provide the feedback that they provided on the RFP, because I think she can summarize it a lot better than I will be able to. And the other thing that we have also done is we are the job description, the job posting ended on Monday, and we surprisingly, I guess I could say, have received 50 applications. So that is a lot, some on island, most off island. And so we are very excited to try to begin that process and see how we can narrow those 50 applicants down. We have also had the Nantucket Employee Empowerment Team, when they met actually yesterday on August 11th, they did a lot of discussion related to a SWOT analysis of what their role could be in the racial initiatives and how they can function as advocates, not just for employees, but for the community. So the SWOT analysis is strengths, weaknesses, opportunities, and threats. And some of that discussion led into this hiring of this position. And they had a lot of great discussion going on. They really felt that even though this is a town position, that they would recommend a more unique kind of process and a hiring committee so that we can provide a little bit more transparency and fairness in the whole entire process than maybe what happens in a typical hire with the town. They also thought that maybe there should be some involvement from either members of themselves, the Council of Human Services, or community. So it is not just internal town members, but also represents a little bit more diversity in who that would be on that interview panel. They also wanted to look at it as a more neutral. So there was a lot of discussion of how you can vet these applications in a more neutral way. Now, these are all conversations that we have also had internally. I know our human resource department has done some great work with this and has been discussing with me as well on how to manage that and create transparency, but also eliminate any bias that might be provided. So what we are starting to do with this position is they have created, only one individual in HR has seen all the applications, and she has developed a spreadsheet that provides us with no names, no addresses, no school names. It is only a number, 1 through 50. It will list their education, their experience, and if they meet the minimum qualifications, and it names their degree. And so that provides us with some type of comparison to what we're looking for in the job with what the person's qualifications and experience are, without providing us with any identifying information of who they might be. And that hopefully will help us through this process when we start the screening. So our first step in doing this will be to screen, and we will be looking at those education experience minimum qualifications as a group. We've developed a panel of 7 people. 2 of them will be internal staff, myself and somebody from HR. Because we don't want to completely deviate from the hire process that we have with the town. We do want to keep some sort of process and normalcy that we normally would have, but we do recognize the uniqueness that this position brings. So in also doing that, we will have 1 board member. So one of you will be in attendance. We do have 1 community member who is from the diversity community, and we will have 3 other town employees who are also of a diverse background. So those 7 people will help us represent a little bit more of what we're looking at in terms of meeting the needs of our community in a diverse manner. We also have asked the Council for Human Services as well as the Nantucket Employee Empowerment Team to help us develop the interview questions. And part of the screening process that we think will help us is that we would like to develop maybe 3 to 5 questions that we provide to all candidates, and they give written answers back. And they will also have no identifying name except to match the number of the applicant with that spreadsheet. And that will help vet the process and figure out who we will interview. If we end up interviewing all 50, then that's what we will do. But we still want to provide that screening and potentially rank and look at who we might have as top players. We will then start the interview process. We're sort of thinking we might have 3 rounds. There's a lot of applicants here. We would have the first round and potentially the second round all be by Zoom, obviously, at this time. And then when we do the final round, we might add a few additional people or maybe not have that full 7 panelists. So we might change it in the final round and then hopefully be able to find some way to maybe do that more in person. And if it's still by Zoom, then we will just have to make do with what we can. And we do want to maybe start something similar to this process where we are not providing supervisors or department heads with the full applications like we normally have, where they then vet everybody out and say, these are the people we want to interview. Instead, we are going to likely develop this process for all positions going forward so that our HR department will go through a similar process. We have 2 individuals who are assigned different departments. So they do the recruitment, they will file it, they will fill it out on the spreadsheet and then provide that so that those type of identifying information is not provided. And so that will be written up in some form and reviewed by town admin so that we can keep that process similar moving forward. And what else did I want to say before I turn it over to, I think that was it. Are there any questions on that?
Jason?
Just a comment. I think it's a great hiring practice. I'm glad we're doing that, and hopefully this process or some variation will, going forward, will be great. That's probably one of the many things this DEI position will be working on is how to really implement that across all the town, and also how do we encourage more diverse applicants, right? Because we can do it blind, and that maybe will help our diversity, but if people don't apply. And so I'm just really excited that we're doing it this way, and once that position is filled, they'll be able to help us even take that further. So, great job.
And it's definitely something that's, it's not going to be set in stone there's elements of the RFP that will also assist us in, making that process a little bit better. And then when the person is hired, they will obviously be probably part of that hiring process as well. So we just thought that, it makes sense to try to start it now, especially with this position. And then, that way we have something to build off of when we do start the position or when the RFP individuals are awarded, so that, we are making strides to recognize what we need to improve upon.
Melissa?
Yeah, thank you so much for all your thoughtfulness in this. And I'm so glad we posted the position, and I'm so glad there was so much interest. I'm really looking forward in hearing more about your assessment of the candidates. And, I can't recall what we had listed as the requirements for the position. And I guess my only concern is that when we're doing sort of the blind screening and looking at education, and I don't remember all the other factors, is that sometimes people with less education have great skill set that they can bring to the table, and the education is something they can get and along the way once they're hired for the position. So I just want you to all consider that as not maybe a hard line factor. If there's opportunity to help someone grow into a position, that I think we should be open-minded to that. But with so many applicants, I'm sure we're going to pick a perfect person.
I completely agree. And I do know that some of the discussion that we had at the NEAT meeting, as well as internally, Amanda Perry and myself, some of the things that we talked about is, sometimes you do know the applicants and they come in because it's a small island, and you interview them and they don't do as great as you anticipated they would do, because that they are, they're very suited for the position. And we recognize that that's part of the entire process as well. So I think that's where we sort of come from. Are we ranking them? Are we vetting them? How are we going to do this? Are we just interviewing everybody and providing that opportunity? Are there minimum qualifications that we can alter or conditional hire? We've done it with some others that say, you have to get this certification by X. So I think we are bouncing that around, and we want to be respectful of that and know that, everybody has their own different skill sets. Some are, you can't learn, and some you can. So we're trying to find a way to incorporate all of that. If there are no other questions, I am going to turn it over to Brooke Moore, who's the chair of the Council of Human Services, so she can give you a little bit of a summary of some of the discussion that they had, more specific to their request for proposal review. And then I can help answer any questions that might develop as well.
Thank you. Go ahead, Brooke, whenever you're ready.
Hi, thank you so much for inviting me to join you this evening and give you some feedback on the Council for Human Services work. The Council for Human Services was asked to do three things at our meeting. One was to look at the request for proposals and give feedback. We didn't spend a lot of time reviewing the RFP because it's so dense and so long that what we opted for instead was having everybody read through it and provide feedback by email. And I would say that the theme that keeps coming up in this conversation around our move toward diversity, equity, and inclusion is, how do you take a system that's not as diverse and inclusive as you'd like it to be, and find the people to figure out how to make it more diverse and inclusive? And so that is a conversation that has was a big theme of the Council for Human Services conversation, is how do you identify, recruit, invite to participate folks who have not traditionally participated in this kind of decision-making and leadership. So the feedback on the RFP, I'm not going to spend a lot of time on the details of it, but that's sort of the theme, is bringing people in and making sure that all voices are heard in the process and recognized as the RFP work, the work of the RFP is being executed. The second thing that we were asked to look at was the creation of a task force or equity advisory board, and the structure of what that might be, where the reporting relationship might be, and so forth. And I would summarize that the end result of our discussion was that CHS didn't feel comfortable yet to make that decision for two reasons. One, that this is a brand new board. This was our second meeting. And second, that the members of the council suggested that the professionals that are about to be hired, the DEI director and the folks who will respond to the RFP, are perhaps in the best position to advise the community with regard to what kind of task force or advisory board would be recommended and how to format it, how to formulate it, how to define its mission, and how to populate it with a broad representation in the community. And a number of our members expressed concern that moving forward with creating such a board now might take us in the wrong direction and has the potential to do harm. Guided by professionals who've done this work, it makes more sense. So our advice was that we wait on that, and that the Council for Human Services is ready and willing to put in their opinions and life experience into a discussion as that process comes along farther down the road. I hope that makes sense to you all. And then the other piece that we really didn't spend a lot of time on was the question about whether or not there should be a community forum orchestrated by the town at this time. And we didn't really talk about that yet. Our meeting time ran out. But I'm going to hypothesize that that sort of falls under the same response as the question about the advisory board, but we did not discuss it in detail. And I really want to compliment Rachel in her willingness to creatively adapt the systems and processes that have been used by the town in the past, both in the hiring and the RFP process, in order to do this a little differently in light of what the work is all about. And I think that that's critical. And I think that's a critical thing to demonstrate to our community. And I really appreciate that willingness by Rachel on behalf of town administration to think differently about how we get this done. So any questions, I'd be happy to answer them.
Anybody have any questions for Brooke? Thank you for all the work you're doing.
My pleasure.
If that's all for the update this week. We can move on to any committee reports. Anybody? Jason?
Just a quick one. I want to give a shout out to everybody that's working in the school system, the administrators, the teachers, parents, everybody who's involved. I was on a call yesterday, 2 calls with Dr. Hallett. She asked me to facilitate a meeting with our health director and Gary Shaw, Dr. Diane Pearl. And so I just got to kind of to listen to all the questions, and really the complexities are so, I mean, there's a lot of layers there. And I just want to send good vibes and appreciation to everybody who's trying to figure out everything with the schools. It's really, really intricate, and I think they're doing a great job, and there's still a lot of work to do. Thank you.
Christy?
Thank you. I was on a call this morning. There was a town hall held by the Cape Cod Young Professionals, and they talked about childcare on the Cape and the Islands, and especially due to COVID, how childcare has been impacted. And it was really interesting to hear how all the different Cape towns have handled childcare pre-COVID and during COVID. But one of the things I wanted to bring up was the town of Easton has an item going forward at their town meeting this fall. But it was supposed to be spring, of course, but they postponed to give up to $10,000 per student as an override. That's for a 4-year-old to help families afford childcare. Part of that is also to provide funds for preschool lunches for kids to take that burden off of families. And so that's going to be going to their town meeting this fall. And they're actually not the first Cape town to do this. This is quite common across a lot of the Upper Cape towns. And so I just kind of wanted to bring it to the board's attention. I know that we have, a council on aging and committees that look at the senior center and our island home. And I just maybe, in the near future, we create a committee that looks at our youngest population and how we provide childcare. And maybe that's something that in the future we have a warrant article with an override to help fund those services. And just tying it to our strategic plan and quality of life, I just thought it was something worth bringing up to and bringing to the attention of the board. The other update is I sat at the mask table and handed out free masks this past Friday, and it was a wonderful experience where many people were already wearing masks. Those who weren't were thankful to get them, and everybody, I would say, 99.9% of the people knew of the mask order. There was about 1 or 2 people who I had to inform about it, but people were very thankful that the town was out there giving out free masks and a few free T-shirts, which they liked. So just thank you to the town for putting that program together, and Taylor Hiltz. I had my niece with me, and it was a lot of fun to get her out there encouraging the mask use and keeping our community safe.
Thank you. Anybody else tonight? Is there a motion to adjourn?
So moved.
Second.
All those in favor by roll call: Matt Fay,
Aye.
Christy Ferrantella,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
Uncle Kate, aye. Thanks, everyone.
Thank you.